is that we need to do more than ever before, adhere to the prescribed non-pharmaceutical interventions, and diligently avoid contracting the virus. A careful study of the numbers coming out of Africa will reveal that there is a flattening of the curve in the African region. There has been a weekly decline in the number of new COVID cases reported since 20th July. Fatalities are also on the downward trend. More than 1 million people have recovered. While this is a welcome development, as we have seen from other regions of the world, that cases can decline only to start rising again. The World Health Organization has informed that it is working in collaboration with the African CDC to launch a network of laboratories dedicated to genetic sequencing so as to better understand the evolution of the pandemic and how SARS-CoV-2, the virus which causes COVID-19, is spreading. Over time, the Presidential Task Force has been sounding the alarm bell of increasing evidence that Nigerians, and indeed Africans living with non-communicable diseases, such as hypertension and diabetes, are more likely to suffer severe cases of COVID-19 and eventually even die. The COVID-19 pandemic has reaffirmed the importance of everyone having access to quality health care that they can afford. Reports have, however, shown that diagnosis and treatment for chronic conditions are among the most frequently disrupted health services globally. A rapid survey by the World Health Organization revealed that 41 countries in sub-Saharan Africa have reported disruptions to such services. It is of great concern to find that just when people with hypertension and other chronic conditions need support the most, many are being left out in the cold. The Presidential Task Force therefore urges the various medical facilities not to neglect patients with other conditions on account of COVID-19. Nigeria continues to progressively witness declining confirmed cases of COVID-19, with a record low number of 79 cases on Sunday, September 13, 2020. While this suggests that we are winning this war, the reality is that we need to improve on our commitment to eliminate the virus completely by abiding with the protocols so that we can return to a semblance of what was our normal life. In a very modest way, therefore, we could say that our national response under the guidance of Mr. President is achieving impressive results, and this has been commended by our development partners. The Presidential Task Force wishes to use this opportunity to thank our development partners, as their support has contributed in no small measures to the successes so far recorded. And we count on their continued support as we progress in tackling this pandemic. One critical element we must not lose sight of is the fact that our cautious approach has tremendously helped in our containment efforts. Therefore, we should avoid complacency at all costs. Our focus should go beyond flattening the curve and ridding our land of this virus, just as we did with the polio virus. Similarly, the contribution of our health workers has no doubt contributed to our gains. In this regard, the Presidential Task Force wishes to appreciate the National Association of Resident Doctors, NAD, for calling off their strike action. The PTF, however, views the recent declaration of industrial action by the joint health sector unions, JHOSU, as rather unfortunate and capable of reducing our gains and endangering more loss of lives. We therefore call on JHOSU to stand up to be counted at this critical moment, because a continuation of the strike could jeopardize the small gains made in the fight against the virus and the efforts to transform our health systems. The Honorable Minister of Labor and Employment has assured that every effort is being made to resolve all issues and have JHOSU call its members back to work. The Presidential Task Force, therefore, appreciates Mr. President for keeping our land borders closed, because those are potential seeding points for importation of the virus into the country. More so, as ECOWAS champion of the COVID-19 response, Mr. President should adopt all practical means of containing the virus within the subcontinent of West Africa. The Presidential Task Force has received with encouragement the recent United Nations General Assembly omnibus resolution seeking for a comprehensive and coordinated global response to the coronavirus pandemic, which further amplifies the significance of Mr. President's role in the West African region. The Presidential Task Force is aware that a number of subnationals have announced the reopening of schools from this week, while others have developed a phase plan for such efforts. Nigerians to always wear a face mask or face covering and to do so properly. Similarly, I remind you to avoid crowded places and mass gatherings. Stay at home if going out is unnecessary, and maintain hygienic practices of washing of hands or using sanitizers. I now call on the Honorable Minister of Health, thereafter the representative of the DG, Nigerian Center for Disease Control, and the National Coordinator to give you all the technical updates on developments, and thereafter you will take further briefings from ministers as they present them. I want to thank you for your kind attention and have a good evening.
Good afternoon, everybody. The Chair of the Presidential Task Force on COVID-19 Response, Honorable Ministers, the National Coordinator, Permanent Secretary, ladies and gentlemen of the press. 79 confirmed cases of COVID-19 infection were reported in the past 24 hours from 13 states of the Federation, bringing the total number of known cases as of today, 14 September, to 2020 to 56,256 out of a total number of 442 42,075 tests conducted so far. 44,152 persons have been treated and discharged, while 1,082 have sadly been lost to COVID-19. Though we continue to record declining positivity rates every day, we are reluctant to conclude that we are halting the spread of this disease because many states have not sustained the testing rate that will give us the assurance. Only 13 states, for example, reported their figures in the past 24 hours, meaning that more than 20 states did not make a report. This can be better. Until all parts of the country can sustain a certain testing rate, it will seem presumptuous to conclude that we are flattening the curve. In the words of the Director General of the World Health Organization, we are not safe until everyone is safe. I therefore again request our state governments to ramp up the testing momentum by ramping up sample collection. We have requested and urged the setting up of sample collection centers at every local government area and in high-burden local government areas in every political ward so that we can improve and increase the tests. We can together get control of the spread of this disease in our country. I had the honor last Thursday of participating in the mid-year program review of the Memorandum of Understanding on Health System Strengthening, Routine Immunization and Primary Health Care entered into by Kaduna, Bauchi, Yobe, Borno, Kano, and Sokoto states with Aliko Dangote Foundation and Bill and Melinda Gates Foundation on the other hand. The achievements of the states in implementing the terms to strengthen routine immunization at subnational levels is impressive, as is also the benefit derived from it in the fight against COVID-19, particularly in the area of surveillance. And then the progress made through that to improve primary health care services in these 6 states. I was particularly delighted with the level of participation of traditional rulers in all these states. I wish to commend the governors of these states for their increased investment in primary health care, as well as Alhaji Dangote and Mr. Bill Gates for their sustained interest and contribution to support these states' effort at building these health structures. It is gratifying that the National Association of Resident Doctors has called off their strike, but unhelpful that the Joint Health Sector Union has begun theirs. The position of the Ministry of Health is that strikes by healthcare workers jeopardize the lives of citizens, especially at such times of global health emergencies as now. Nigeria needs the service of all her health workers to control the spread of COVID-19. Issues around allowances are multi-sectoral and have always been solved with negotiation, no matter how long it took. But I also acknowledge the commitment of the health workers who continue to man the front lines in the fight against this disease, and I use this opportunity to appeal to JOHESU to suspend their industrial action and go into negotiation so as not to erode the gains we have made since healthcare in the healthcare delivery area. The Federal Ministry of Health is doing all it can and all within its power to expedite processes that address the bones of contention. I also paid a working visit to the Nnamdi Azikiwe International Airport yesterday to review the processes of passengers arriving on international flights and to observe their health-related compliance and the challenges of staff of port health services. My observations and suggestions for remediation have been made known to the PTF and to the Honorable Minister of Aviation. I thank all travelers for their patience and understanding as the process to keep our country safe are being further fine-tuned. I also advise the intending travelers to or out of Nigeria to acquaint themselves with regulations and the provisional quarantine protocol. You can find this on the websites of the Federal Ministry of Health or the NCDC. Our primary concern is to limit the risk of importation of COVID-19 virus into our country, especially with the increasing flights to Nigeria. And for this purpose, we have remained very vigilant. Our health system should not be overwhelmed by new imports, even as we struggle to contain the COVID epidemic in country. There are still no reliable new therapeutics available, and vaccines are still up to 1 year away. The much advertised non-pharmaceutical prevention measures remain the backbone of our defense, and I urge all citizens to maintain these. There is no doubt that the economy needs to be further opened and business activities and commerce must resume. To compensate for all of this, we all need to cooperate and ensure that we are following the non-pharmaceutical interventions as our own contribution. I thank you all for your attention.
Good afternoon, Chair, and honorable ministers, ladies and gentlemen. My focus is actually going to be on self-isolation, and that's because we want the travelers that have come in to know what to do when they come in. They're expected to self-isolate and for 7 days, at least 7 days, and then get tested for a second time in country. So as we are all aware, we have put several measures in place to ensure that as the international flights resume, we do not see an influx in imported COVID cases. So it is important that we maintain the gains that we have achieved so far. And to achieve this, we need cooperation of all returning passengers and their adherence to the protocols that have been put in place. This is not only for them to protect themselves, but also for them to protect their loved ones that they have come to meet, and also Nigerians at large. So when we say Nigerians should take responsibility, we know this cannot happen in a vacuum. Therefore, we have continued to develop and update our guidelines in line with the best global practice and available evidence. Recently, we updated the self-isolation guidelines to reflect the current protocol for returning travelers. For every passenger that comes into the country, you must self-isolate for 7 days, for at least 7 days. This means strictly staying at home or an identified accommodation, away from situations where we will mix with our family members or the general public. On the 7th day of isolation, you must present at a designated sample collection center for your sample to be collected for tests. And the purpose of this is to ensure that you eventually test, and if you eventually test positive, you are, of course, when you're self-isolating, you would not have put your family members at risk of infection, particularly your loved ones. So for people who test positive, they will be treated based on the National Case Management Guideline, But if you're tested negative after the 7 days of self-isolation, you'll be free to join the society, that's your family members, the community, free to move about. And then you'll have that confidence that, of course, you have not infected your family members and your friends. The self-isolation guideline is actually is a guiding document and can be accessed at covid19.ncdc.gov.ng. So we urge all incoming passengers to take responsibility and contribute to the efforts that is being made to halt the spread of COVID-19. While you're in the country, it is important to continue to adhere to all measures put in place by the federal government to protect Nigerians. And this includes wearing your face mask in public places after you have exited, washing your hands frequently, maintaining physical distancing, and other public health measures recommended. So we want to urge our travelers, our incoming friends and loved ones that have come back to please adhere to all the non-pharmaceutical intervention and to also self-isolate for 7 days, so that once your sample is collected on the 7th day, if you're negative, and that's good, and so we know that you're free to move about. But if such a person is positive, we will take and manage the person using the guideline, the case management guideline. Thank you.
The chairman of the Presidential Task Force, honorable ministers, members of the PTF, gentlemen of the press, good evening. So today I'll be talking along the same theme of international travel. As you're aware, we opened up the airports, specifically Lagos and Abuja, on Saturday last week. So we're getting to about just over a week now. And I wanted to update you on the Nigeria International Travel Portal. I know there's been a lot of publicity around this, and I wanted to clarify some issues. So, as you're aware, it's important that we realize we are yet to flatten the curve of coronavirus in Nigeria. And because of that, we have to ensure that we put in place all necessary interventions to stop the importation of new infections into our country. The PTF has continued to ensure that our responses to COVID-19 is based on sound science and data. But we are also borrowing from the experiences of other countries globally, since the world is a global village. So this is why we have established an online registration portal as part of our risk mitigation measures following the publication of our travel guidelines for international travelers coming to Nigeria, and in order to make that experience as smooth as possible for the passenger. The portal itself is a tool that ensures travelers coming to Nigeria register on the platform and complete all the necessary steps required to comply with the travel guidelines that we issued on the 5th of September this year. So what are those steps? This specifically applies to passengers outside Nigeria, not those leaving Nigeria. If you're outside Nigeria, the first step you need to do when you are coming into the country is to go and have a COVID test done. This test has to be a PCR test. We do not accept antigen antibody serological tests. It needs to be done from a certified laboratory in the country you're in, and we already have a list of accredited labs from countries that we initially had issues with their results. The test needs to be valid for no more than 96 hours. Preferably, the closer it is to the time of boarding, the better. Passengers without a valid PCR test or those with a result older than 96 hours will not be allowed to board the flight. Once you have your COVID PCR result and it's negative, you go onto the portal which is nitp.ncdc.gov.ng, nitp.ncdc.gov.ng, and you register on the portal. When you register, you will fill the pre-boarding health declaration form. This is the same form that people used to fill manually in flight or on arrival in Nigeria. After you fill the form, you will be asked to upload your COVID-19 PCR result. That's negative. If you upload a positive COVID-19 PCR result, you'll still not be allowed to board. It has to be a negative result. Once you upload your result, you will then go ahead to fill in where you are arriving to, whether it's Abuja or Lagos. We are making subsequent adjustments to the portal to enable us find out exactly where you will be on day 7 after arrival, whether you will be in Maiduguri or Port Harcourt or Calabar, so that you can choose a sample collection center within the city that you'll be residing on day 7. For the moment, we have laboratories across Abuja and Lagos only, but we've made arrangements with these laboratories to make sure that when you pay, wherever you are in the country, they will arrange for a sample to be collected from you. But we are really encouraging private laboratories outside Abuja and Lagos to work with their state governments in order to get onto the platform and provide improved access to testing for travelers. If you encounter issues with payment, this is a card payment. If you have international card, it will be easier for you to choose the dollar option rather than the naira option. And there will also be a button for PayPal for those that are unable to use the normal Nigerian banks for paying. If you encounter issues with payment, you may still pay at the airport when you arrive. However, just to make it clear, it is much faster for you when you arrive Nigeria if you have already done all these 3 steps and you have paid. It's a very smooth process. If you don't and you have to pay at the airport, then you should be ready to experience significant delays in the process of clearing. Once you arrive in Nigeria, you will have a barcode or a QR code that you will present at the airport. They will be able to download your information, confirm whether or not things have changed since the last time you completed your health declaration form, and ask you to proceed to immigration for clearance. Since starting this process, I am pleased to inform you that travelers arriving to Nigeria have been using the International Travel Portal, and we've actually collected data on how the portal has been used thus far. So far, 9,409 travelers have registered on the portal, where 5,541 persons have made a payment through the portal. Based on our technical analysis, it appears 5% faced technical difficulties with payment. About a third of travelers did not register with the portal. We do not know whether these travelers subsequently paid on arrival or were able to get to a bank to pay for it. And just to make it clear, it's mandatory that you have the PCR test done on day 7. So if you arrive in country and for whatever reason you do not have a card that works on the system and you are unable to pay at the airport, you will still have to make arrangements to pay before day 7 of your test. If you do not have a test by day 14, regardless of whether you have paid or not, we have a system for identifying persons with Nigerian passports, and restrictions will be placed on these passports for a 6-month period. For those that are non-Nigerians that have not had the PCR test done between day 7 to day 14, on their way out of the country, we will revoke their visas. So there are clearly implications for not following the travel protocol. And this is done in the best interest of the public health of our country. The PTF remains committed to transparency and good governance. None of the funds that's being paid to the laboratories is going to either the NCDC or to the PTF. A small fraction of that will be going to the state governments where these labs operate for the purpose of admin, logistics, and data management, and the rest goes to the laboratories. We are urging laboratories outside Abuja and Lagos to please key into this, because the more labs we have operating, the easier it will be to drive down cost and improve competition. It's not a procurement process, so you can have as much as 100 labs in Lagos and Abuja providing this service. The three key requirements are you have to be licensed by the Medical Laboratory Science Council of Nigeria. You have to have NCDC validation and optimization in order to function as a molecular lab. And then thirdly, you must be accredited by the state government that you are operating in, because your test results will feed into the state numbers. We have worked day and night with our partners, CARCOVID, to ensure that the travel platform operates smoothly. We know that there are still some issues with the platform that we are resolving, but overall, at the moment, it appears to be working well for the vast majority. When we started using the platform in the first few days, 90% of all travelers were able to use the platform without any issues. Nevertheless, we do not want to place undue restrictions on Nigerians coming into the country that genuinely cannot use the platform, which is why we put on hold the requirement for having a QR code or barcode when you're arriving in country. But we are working towards making sure that a QR code can still be generated where you have not finished payment, provided there's evidence that you have attempted paying, so that at least we will have your health questionnaire and you will have your COVID-19 PCR negative result electronically available for us to be able to review and go back to if there's an issue. So that's with the travel portal. I wanted to just say quickly something about the upcoming elections. As you recall, last week we had the INEC chairman here. We are urging the public and state authorities to continue to follow INEC's safe election guidelines. If you're going for voting, you must wear your face mask, sanitize your hands regularly, and observe all those measures, including the physical distancing measures required to protect yourself and others around you. And please remember that no mask means no vote. Finally, we would like to, on behalf of the PTF, extend our gratitude to CARCOVID for their unwavering assistance and partnership towards making sure that our airports open quickly. We'd also like to commend the Northern Traditional Leaders Committee for cooperating with the PTF at our recent meeting with them. They are setting up a strong example for their communities and supporting the national effort in the fight against COVID-19. Thank you.
Mr. Chairman, and my friends, gentlemen of the media. Well, it's a very short one from Aviation today. This is regarding approvals for flights within the country, domestic approvals. So all airports in Nigeria are now open for flights, for domestic flights, including those that are in private charter operations will no longer need approvals from us to go domestically, to operate within domestic airports, in all government-approved airports and in all government-owned airports. However, those airports that are private airports, which are called government-approved airports, but they are private, the operator should check the safety status with NCAA. Such airports like Jalingo, Uyo, Asaba, Gombe, Nasarawa, Damaturu, Osubi, etc. So you wouldn't need any approval from the minister, but you should kindly check in this kind of airports with the NCAA regularly, which is normal. However, all flights out of the country that are private charter will still do need approvals for those kind of flights. So also coming in, including tech stops, technical stops, would be needing approvals. So with this, it means that the approvals that are sent via either NCA, NAMA, or myself will cease, and if there's any change, it will be so advised accordingly. Thank you very much indeed.
Thank you. We've taken all the updates. We'll now take your questions.
Good evening, honorable ministers and my colleagues. My name is Friday Okerigbe. I'm a reporter with Channels TV. I'd like to direct my first set of questions to the NCDC. Madam, I would like to know what statistics do we have of people who traveled in since the last 1 week that the international flight is opened that have tested positive for COVID-19? And regarding the self-isolation, I'd like to know what strategy specifically do we have in place to monitor those who travel in, that they comply with that directive, that they must self-isolate for 7 days? What strategy do we have to monitor it? And for the health minister, I'd like to seek clarifications from you. The record we have, 97 cases from 13 states. What exactly does this mean? Does it mean that only 13 states did carry out testing in the last 24 hours, or only 13 states recorded positive cases in the last 24 hours? Clarification, sir. Thank you.
Good evening, all. Rachel Abuja from the News Agency of Nigeria. My first question is for the coordinator. Sir, don't you think it's ideal to allow testing lab close to the airport, or let's say around the airport? Also, Nigerians would like to know how much fraction of the testing fee will be going to the state government or NCDC. Then my third question for you again, sir. How is the financial sustainability plan like for the national response in case this pandemic extends to the next 6 months, especially as donors' fatigue seems to be coming in now? Then to the Minister of Health, sir, the non-communicable disease, which are the underlying illness that aggravates mobility and mortality in COVID-19 infection cases, with hypertension, which the SGF just mentioned now, said to be prevalent in 29% of adults above 20 years in Nigeria. In which areas are we going to be re-strategizing and, let's say, repositioning our healthcare delivery system to fit into or to manage and control the rising cases of non-communicable disease in the country at the moment in view of escalating this pandemic, sir? Thank you. Then for the representative of the NCDC, what is the NCDC doing, like advising concerning states that are opening schools or will be reopening schools in light of the passive end of first wave due to the reduced confirmed case? Thank you very much.
Mr. Chairman, members of the task force, my colleagues, good afternoon. My name is Nancy Oyedia Orom from AIT. I would like to direct my question to the Minister of Aviation. So some time ago, the European Union listed out some countries that have been banned from entering their country. Yes, Nigeria happens to be one of those countries that have also been banned. Yes, some time ago, you also mentioned that Nigeria would do same based on reciprocity. Now, I want to know, beyond reciprocity, these actions have also affected so many Nigerians. Take, for instance, I have a colleague who had an air ticket with Lufthansa, which has also been banned in the country. He was moved from one country, one aircraft, a journey that was supposed to take him about 6 hours to the UK. It took him about 2 days. That is just one case out of so many other cases which Nigerians are also going through. So it brings me to my question now. Where exactly are we now with the EU? Are there talks so that the country, Nigeria, and the EU can come to a compromise? And aside reciprocity, I want to know what parameters did Nigeria put in place in banning some of these countries? And I've heard a lot of people say Nigeria banned some of these countries from coming. That is political. So I wanted to just clear all of that. And finally, to you also, don't you think this action will also affect bilateral relations between Nigeria and some of these countries? My next question is to the Minister of Education, sir. So yes, COVID-19 have taught us a lot of lessons, which has made us to adapt to e-learning. Looking at the fact that our schools may be resuming very soon, are we seeing an upskill in e-learning in some of our schools? Thank you.
Good evening, the chairman and members of the PTF. I am Itaire Ikben. I report for the NTA. My first question is for the Minister of State Education. Information is rife in public domain that the federal government has given the go-ahead to all command primary and secondary schools to resume or reopen on the 21st of September. Is this true? Please, you clarify this for us. And secondly, how soon are schools likely to resume? Will they resume during this third phase of eased lockdown? And for the representative of the NCDC, I think about 3 states, Kogi, Zamfara, and Sokoto, have no active case at the moment, and Kebbi has just 1 case. I want to ask, is testing really going on in these states? Thank you.
The Chairman, National Coordinator, members of the PTF, my colleagues. My name is Amaka Ode. I report for Arise News. And 2 simple questions. The first question happens to go to the Minister of Aviation. Now we've actually started the air operations in both Abuja and Lagos, and you've actually spoken about some of the challenges. Even the National Coordinator also reiterated them. Nigerians want to know, since we're still talking about self-isolating, are we looking at opening the other international airports anytime soon to make it easier for them? And my next question happens to be for the Minister of Health. Well, last week, the chairman did speak on fatigue. And I remember I'd asked you here a couple of times about the psychosocial support the frontline workers, who are the ones at the isolation center, they get. Unfortunately, I went to some health facilities over the weekend. There is no help in that area. What is going on in terms of helping these people deal psychologically with what they're dealing with? Thank you.
Good evening, members of the PTF. My question is for the coordinator. I'm sure when you were talking earlier, you were reacting to the media report about fraud taking place at the airport. Regarding the testing and all that. So I'd like to know, you keep threatening to revoke international passports of those that have failed to turn up for the second testing. But some of them are complaining of challenges, having trying to do the test. What effort is the PTF doing to address these challenges? Thank you.
Thank you. We've taken in all the questions. We'll be responding in the following order. The Honorable Minister of Health, the DG NCDC, the National Coordinator. After that group, the Honorable Minister of State Education will come to the podium. Then we'll take the Honorable Minister of Aviation before the chairman rounds it up. So we'll begin today with the Honorable Minister of Health.
Thank you. So there are just a few questions directed at the health sector. The question of reporting. The entire surveillance, diagnostics, and response is interrelated. It's an interrelated activity. The NCDC, as you know, is a federal organization, and they are responsible for surveillance, diagnostics, and mainly, and then they support the states in other activities. Now, the state governments are the ones who, again, push the actual activity of collecting samples, working out the surveillance, contact tracing, and so on. So there's an interdependency in there. And then not even all the laboratories belong to NCDC, we must make that clear. Even though we are activating laboratories, some are private, some are state-owned, and so on. So the job of NCDC is largely to coordinate, and the interdependency means that there must be sample collection going on. We urge them to do that. And then testing going on. Or those who, if I want to send their testing directly to NCDC, are also welcome. But the NCDC can only report what it gets. And despite the good connectivity between states, it's not always that you get results if things are not working well in certain states. I'm sure the NCDC representative will also speak about that. But the report we got now shows that results were reported from 13. Whether they tested more, whether more states tested, it's possible they did, but maybe they didn't report immediately or were late in reporting. There's a deadline within which you must have reported. And if you didn't report to that point, it won't be captured. So perhaps they did, perhaps they didn't test, perhaps they collected. Those are things that will show up later on. They will talk because of the interdependency. You can only speak on what is supplied to you. Now, as for the psychosocial support, it is being carried out in those hospitals where you have first the facility patients and then also the specialists for it. And it goes in various forms. I can't give you exactly details about it, but I spoke with the Commissioner of Health in Lagos State, who takes it very seriously, and they do quite a bit of psychosocial support in there. Here in Abuja, we shall have to know the extent of it from the FCT authorities, because as you know, the FCT is the one managing the cases in their own domain, just as the states manage. So the extent of it, but I know that we have discussed it with Federal Capital Territory authorities. Now, the other question is about the vulnerables. We have said that more than half of all the fatalities we have seen in COVID-19 are from persons who have pre-existing diseases and those who are over 50, whereas more than half of the cases in total are actually under 50. So we have said repeatedly here that we need to give particular attention to the vulnerables. And that's why we target our advisory on wearing masks, sanitizing, staying home at vulnerables. If you're hypertensive, you are known, you have heart disease, you have kidney disease, cancer, HIV, diabetes, even obesity, you are vulnerable. And that is why we particularly target stay at home, do not go out unless you absolutely have to. Particularly also the elderly, stay home unless you absolutely have to. And if you absolutely have to, take all the measures. Avoid crowds. Where there's a crowd, go another way. Make sure you have your mask on. Do not let your mask hang under your nose or your chin. And wash your hands frequently. Take care of yourself. So the vulnerables can even avoid getting infected. We have gone so far as to suggest, in case of mass infection in vulnerable, in particularly hotspot states, hotspot local government, creating the community support centers, one set that might take in the very at risk, but with mild or no symptoms, and perhaps another facility that could temporarily take in the vulnerable and the elderly for protection if you have a mass infection. Fortunately, we have not faced that situation, but we are prepared for that. We have discussed it, we have planned for it. That is what we have been working with the National Primary Healthcare Development Agency to have a strategy like that. We have said that we want to reduce the case fatality rate to less than 1%. And part of the strategy is giving that special attention to the vulnerable and among us. And we need their cooperation. We need their cooperation. We need their cooperation with the general public also, to help to avoid the risk factors that put the vulnerable more in the line of facing the consequences of a COVID infection. Thank you.
Yeah, thank you for the questions. I think Friday from Channels asked about the statistics of people who traveled in the last 1 week, the positive ones. For now, we have not gotten that data together. We're still working on that. Don't forget, it's just the 7th day that they're supposed to be tested, and once they're tested, the result comes out, and then we are able to get that data. So those that have that came in first are just getting tested, and once we get the results, we'll be able to get that across to you. And then in terms of the strategy that we're using to monitor, now when they come in, some of them are not based in the point of entry, that's Lagos and Abuja. So the state epidemiologists of the states that they're going to are notified, and their numbers are given to them to follow up. So they make a call to the passenger of interest to follow them up. That's what is done. Now, at the national level, we also have an automated call system that once you key in the number, it automatically calls those numbers and asks for some various questions in terms of where you are and if you have symptoms. So that's the strategy we're using. So it's both at the national and state level that we monitor the passengers of interest. And now, Rachel, you asked about the advising schools. Yes, we're working with the Ministry of Education. We have developed guidelines, actually. Now, what we want to do is to make it simpler and easier for them to use. And so we're developing like a one-page protocol that will guide the schools, and so that it's easier for them to read and follow up. Now, one other thing we're advising the schools to do is to resuscitate their school health program. Now, this will help because in the school health program, you have other stakeholders involved, not only the Ministry of Education or the nurse in school. We have the Ministry of Health. You have so many, even within the community, working together. So if there is any event in the school, they are able to come together and respond. So those are the kind of things that we're putting in place. And then at the state level and local government level, we expect that they conduct risk assessments regularly. And that is, at the school level, they conduct risk assessments every week, looking at the children and assessing the situation. we expect that they have someone or a team that will be monitoring the children as they are, for symptoms. For those in the boarding house, they have a clinic that will, they have a team in the clinic that will be monitoring the children regularly. So those protocols we are going to put in place. We are working with the Ministry of Education to get that to the schools, to the state level, and from the states to the local government. I think for the states that have not reported active case, I think my minister has answered most of the question. It is what the states give to you that you get. We have a platform where they report, sending the electronic reporting to us. Now, some of the states have issues with their laboratories and they are not testing. But so what we say is send your sample to our national reference lab and they test for you. Some have still struggling to get people to come for testing, to come for their samples to be collected. So, but we're working with the states. Those that are not having active cases does not mean because they do not have active cases, they are not working. And so there's a difference between having a confirmed case and collecting samples. We can collect samples and not have a confirmed case amongst the samples that you have collected. So we're looking at the situation. We're really monitoring the states to make sure they do what they're expected to do. And the PTF chair has really, employed all the state governors to be active, to please support their state team to make sure that samples are collected. Especially, we want that all LGAs have sample collection sites. And then we encourage our people to come out and get tested. Thank you.
Okay, so the first question, I think, was Rachel. You wanted to know why are we not allowing testing at the airport or close to the airport? Okay, so when you are coming to Nigeria, assuming 100 of you have caught COVID on your way to the airport, but you have had a COVID test done a day earlier that's negative, all of you will board. When you arrive in Nigeria and we test you at the airport, we will pick only 7 of those 100 that have caught COVID on their way in. If we delay the testing till day 5, we'll pick an average of 85 of you. If we delay the testing till day 7, we'll pick 94 of you. If we delay the testing till day 14, which covers the whole incubation period, we'll pick 99% of you that have caught COVID on your way in. Hopefully that will not happen. That is why we said if you are coming in with a COVID-19 PCR result that is negative and was done very close to the point of departure from your point of origin, and you come into Nigeria, there is no logic for you to have a repeat test there and then, because we are only picking up 7% of you. It's better to delay the testing and ask you to go and self-isolate. Day 7, we will repeat the test, and we will pick up 94% of you. And if we pick you up, if you're positive, we will isolate you and we'll treat you. The remaining 5% is a risk that we have to carry as a country, because we know the majority of people will be unable to self-isolate or quarantine for 14 days on their own. And that's why we're providing that incentive of reducing the isolation period to day 7, but with the proviso that we want to test and pick out those of you that may have picked the infection on your way in. Therefore, Rachel, there is no point in having a laboratory at the airport or a laboratory close to the airport if you are having a COVID-19 PCR test on boarding the flight. You can either have one of two things. You can either have a test done before boarding, or you have a test on arrival immediately. But there's no point in having both at all. It will be exploitative, it will be unnecessary, it will be additional cost to the passenger, it will be inconvenient, and it will be invasive. So that's why we are not putting infrastructure at the airport for the moment. We are looking at the current process to see how things go over the next few weeks. If we continue to have challenges, we've already started a concession process pre-boarding. And I'm sure you and I will prefer to sit and have lunch or dinner in flight with somebody that we know is not infectious. So the advantage of having a result from somebody pre-boarding far outweighs the issue of testing afterwards. Okay, so that's why we're not having testing. So there are certain things that we put in place as incentives to make people to cooperate with the new policy. So with the old policy, when you land, your passport will be taken away from you. With this policy, provided you have paid and showed evidence of payment, you go with your passport. With the old policy, we would expect you to stay in Abuja or Lagos, wherever you arrive, until you have had a test done and until that test is negative. With the new policy, you go to Maiduguri or Sokoto or Port Harcourt, wherever you are, and we'll arrange testing for you. So it's a lot more convenient. And then the issue of isolation, with the old policy, you isolate for 14 days. With the new policy, we've shortened it to 8 days max. And therefore, you can go ahead to do your businesses after 8 days. Of course, there's nothing like a short-term visitor to Nigeria anymore. If you're a businessman, you're coming in for business in Nigeria, you have to include that 1 week isolation. You cannot just come in, go for your business visit, and then leave the country. For now, this is COVID. We are not working in normal times, and you cannot come in and just go straight into the community for whatever brought you in. You have to put that 7-day period in. Okay, so there was the issue of why are we making threats to cancel passports, and after all, people are having challenges doing the test. So my call to those that have already come in and we've allowed them to proceed home, etc., is please go back and try the portal again. We've done a lot of work to the portal over the last few days. We expect in the vast majority of cases it will work. Mostly it has to do with the use of international cards. There are telephone numbers for the labs that you may have chosen. You can contact them directly to make arrangements. You can also pay in the banks for your test. So we've streamlined it. In the past, the QR code has to be emailed to you. Those of you that had Yahoo accounts, Yahoo was identifying it as spam email and blocking it. So now we have a system where the moment you pay, the QR code, the barcode comes up straight away and you can print it. So we've done a lot of work on the portal. We are interested to know how it's working, and if you're still having any challenges, please get in touch with us. But almost certainly there shouldn't be any issues with the portal. This is the best way for us to be able to open our airports and be able to get back to business again for the country. There was a question about what proportion goes to the states in terms of the cost. So the negotiations for the total cost is being done at individual state level with the laboratories. We will have a ceiling. We don't expect any state outside Lagos, because Lagos already had their payment portal. It was already up and running. They had signed their MOU with the labs. They had about 10 labs, so we couldn't change that arrangement when the national portal was coming up. But moving forward, all the charges will have to be single-figure percentages, including the bank charge. And we will continue to work with the state governments to make sure that the cost is minimized for the passenger. We will push it as low as possible, depending on how many laboratories we have on the portal. So if you have only one laboratory in a state, it will be more difficult to negotiate between the state government and the lab. But if you have several labs, it will be much easier for them to push down the cost, which is why we're saying private labs for those states. And we've already reached out to Kano, to Kaduna, to Katsina, to Anambra, to Edo, to Imo, and Nasarawa. These are places that already have labs that are accredited by NCDC, and they are part of the NCDC laboratory network. Let's get you on board. The more labs we have covering all parts of the country, the easier it will be to push down the cost. We know PCR is expensive. There's no doubt about that. But at the same time, we don't want passengers to be unduly burdened. And that's why when it comes to exclusions, exceptions, we're making exceptions already. So if you are in a vulnerable group like the young girls that are coming in from Lebanon, they will not pay. If you have had your ticket paid by a UN entity or IOM, etc., for the purpose of deportation or another country, we know that you're probably not going to be able to pay, and we will get the public health system to pay for your test day 7, well, to have your test done day 7. And also, young children will be excluded, and those with diplomatic passport holders will be excluded because they have other arrangements for testing outside the private lab network. So, sustainability arrangement for COVID-19 as a response. Well, all I can say is this is a pandemic, okay, Rachel? In a pandemic, you have costs attached to it. But what will be good is for the country to learn from the experience of COVID. In other words, try to normalize and integrate the things that we know should be part and parcel of our daily routine when it comes to delivering healthcare. So, for instance, all medical wards or surgical wards should have hand-washing facilities. When you walk in, you have running water that you can wash your hand. When you see a patient, in between patients, you wash your hands. Simple infection control. 2, training of healthcare workers should not be based on just having an epidemic of Ebola or Lassa, etc. All healthcare workers should know how to use PPE. They should know how to pick up danger signs in patients presenting, and they should be able to handle infectious cases. And then thirdly, provision of PPE should be part and parcel of routine procurement processes for health institutions. So in the same way that you're buying paracetamol or syringes for your hospital, you need to make sure you have masks, you have gloves, you have coveralls, etc., in the event that you need them. I think I've answered all the questions. Thank you. Sorry, Rachel? Oh, okay. So the budget, in fact, we had, so as you know, the PTF budget is divided into 2. We have money that is coming from the MDAs. It goes as part of the normal 2020 budget. And then we have money that's coming from a special intervention fund that was given to PTF. 22 billion naira was given to the PTF as the first tranche. Of that 22 billion, we paid 1.2 billion to the security agencies, 250 million to Federal Ministry of Foreign Affairs, Ministry of Foreign Affairs for the evacuees. We had operational costs to some of the MDAs, but in total, we've spent barely 3 million. We still have about 19 million, of which 8.4 billion was given out as procurement by NCDC that was approved by FEC. So, Rachel, we still have more than 70% or so, or 80% of the money we were given, first tranche. And we are already almost month 6 into the response. So hopefully we would not have to go back to government for a huge tranche of money going into the next 6 months. And as you're aware, we've had tremendous support from the private sector, from the UN single basket, etc. We have the portal. Please go onto the portal. We have the transparency portal where all the donations are there. All our money is there. And we will also be providing information on what we have been.
Don't touch, don't touch. It's fake. Don't touch, don't touch. It's bad. Don't touch, don't touch. It hurts. Don't touch, don't touch. It destroys. Don't touch, don't touch. It kills. You should know where to go. The SON. Standards Organization of Nigeria, improving lives, through standards.
We are leaving nothing to chance to protect you from substandard or fake products as part of measures by the agency to ensure that consumers get value for their money. 3 container load of substandard electric cables have been destroyed as the Standards Organization of Nigeria develops more protocols for the benefit of the people. Good evening and welcome to Standard and You, Africa's authoritative public enlightenment program. It's Nigeria's finest brand on product quality and safety on television, powered by Nigeria's foremost responsive government agency, brought to you on Mondays at this time on this station. Accept the assurances of the warm regards of the Director General, management and hardworking staff of the SON. My name is Ifoma Okonkwo and thank you for watching. Please stay tuned to the program. I will be back shortly.
The Standards Organization of Nigeria, SON, brings a new lease of life to Nigerian SMEs. SON has put a greater premium on developing standards aimed at improving the exports of the nation's food and cash crops. This explains why we have developed more standards for Nigeria's produce like sesame, cocoa, curry, and more, courtesy our accredited state-of-the-art laboratories. In keeping with the federal government's ease of doing business, SON simplified its processes and turnaround time for SunCap and ManCap to reduce substandard products and legal arm to prosecute offenders. Join the Standards Organization of Nigeria in ridding our nation of substandard goods due to consistent market surveillance and raids. See something, say something. The Standards Organization of Nigeria, improving life through standards.
You're watching Standard and You, and thanks for being there. Every time you deploy new ways of importing into the country fake and substandard products, be rest assured that we are ahead of you and will find you no matter your location in the country. Impound and destroy your products. Director, Inspectorate and Compliance Engineer Obiora Manafa gave this assurance when the agency destroyed substandard cables in Lagos.
I am standing on a heap of substandard electric cables. These cables are all imported from other parts of the world. Imagine what would happen if these electric cables find their ways into the Nigerian markets. Your guess is as good as mine.
These cables have been tested and found to be substandard, having failed all parameter and performance tests conducted by the Standards Organization of Nigeria, as explained by the agency's head of Inspectorate and Compliance, Engineer Obiora Manafa.
These are products that, if allowed to get into the market, anybody can buy it. It can destroy properties. It can kill people because of the level of failure of these products in the laboratory. The products failed woefully. They failed the key parameters, There are some performance parameters like the conductor resistance, which is one of the major key parameters. The cable failed. The standard stipulates, depending on the size of the cable, the maximum conductor resistance for each cable. Sometimes they will give you, the standard will say 12.5 ohms, 8 ohms, 10 ohms maximum, But when we test some of these cables, if you test some of these back cables, you get values up to 1,000 ohms. You get values up to 1,500 ohms. At times you get values 600 and something ohms, as against 10 ohms maximum. So you can see the level of infraction, level of non-compliance. These are cables that can burn down any facility you use this cable on. What they do is, because of the high conductor resistance, it does not allow free flow of current.
A closer look at the bad electric cables reveals that the importer cloned selling popular brands produced in the country and flood our markets with such products and sell at a ridiculously cheap price. This is so because it's a known fact that made in Nigeria electric cables are the best and of acceptable quality.
We are looking at two scenarios. One, protecting the importers, so that they will not lose money. Protecting Nigerian users so that they will not be killed. the safety aspect of consumers. So we are trying to strike a balance. Striking that balance means we want Nigerians that do this importation to make money from their businesses. You know, we are not happy we are destroying these ones. But our hands are tied. We don't have any option than to destroy. Because when you weigh two options, which one is more important? Is it to protect somebody that went outside the country and brought something that will kill Nigerians, protect his interests, or protect the people that will be exposed to this danger of this product? So you can see the protecting lives is more important in this aspect. But we are trying as much as possible also, to prevent this thing happening by engaging them in, advocacy programs, sensitizing the importers to do the right thing. We always go to the markets. We call the stakeholders every time, teach them the importance of complying with standards, so that these things will not be happening every time. We are not happy burning all these things every time, destroying them, because it's money.
No doubt, the SON, working with relevant stakeholders, have put in a lot to clean up the electric cable market by providing operators in that sector with basic technical support to help them grow. SON says it's not safe to use substandard products, especially live endangering ones like electric cable.
We are here to synergize with our sister agency, SON, the Standard Organization of Nigeria, in the process of destroying counterfeited cable wires that were imported into the country by unscrupulous businessmen. This will require us stepping up our surveillance, then policing our ports, so that at least we ensure that these things does not continue to happen in our society. They are dangerous to human beings, they are dangerous to consumption. These are things that can really consume life.
Sun is destroying this thing in an environmentally safe manner. Now, these things actually contains hazardous substances that are harmful to human health. And thank